Hi, I'm Ashton, and today is January 16th, which means it is officially my 1 month post-top surgery. You are seeing this later than January 16th, we're just going to ignore that. So if you watched my 3-week update, I did mention that I do have a complication, and I do have a couple, but I'm not going to talk about those in this video because I want to do one video on my entire left side complication once it is all healed and all done with, so I don't have to do multiple videos on like a disgusting thing, because it's not pretty, and I know that there will be some of you that just don't want to watch it, which is fine. First I'm going to do my range of motion, because that's kind of a big thing, since I'm going back to school playing flute. Hopefully I'll start riding again in the next couple months, and I can't, move all that well, but my arms can go like up to here, a little bit past parallel, and then, my elbows are fine. But I can't get anything past here. I can't go above my head. I can wash my hair on my own, which is nice. So that's range of movement in that ways. My shoulders can pretty much move anywhere. It's a little bit sore, but it's not to the point of I think I'm hurting myself by moving. If that were the case, I wouldn't be moving that much. So this side is the side that's healing better. You can tell because it doesn't have a giant, 2-part band-aid on it. The nipple scab is literally so close to coming off. I barely have any of it left. This is all nip. Like, that's my skin. That is my nipple. He's there. He's doing good. I'm gonna do the Q-tip test thing for sensation. So on the nipple, I don't feel anything, but that's totally normal. As I've said before, sensation takes quite some time to come back. So here, I don't feel anything. Below, I don't feel anything. There, I feel things. So it's like right around here, where it transitions from me feeling things to me not feeling things. Here I feel everything, and then here I start to lose feeling. So, it's in different places everywhere. I feel everything like up here, obviously. Along my armpit on this side, I actually am almost completely numb. I think they might have had to do more liposuction on this side. Almost everyone's chest is asymmetrical, and I think I might have had a bit more tissue on this side. I don't know. I do know that they removed 3.5 pounds of tissue in total, which I thought was pretty interesting. So sensation along here, I still have, none of. I can feel as I go further up, but here, next to the incision, I feel almost nothing. Even under the incision, I feel a lot less here, and I feel, down further on my ribs. But next to the incision, I feel pretty much nothing, which I'm not worried about. That's normal. Along this side, it's pretty much all the same. So I'm not gonna, explain that, because sensation is the same on both sides for me right now. Aside from sensation, let's talk about pain. So I'm actually not in a lot of pain. It can hurt when I play flute, and for those of you that don't know, the position for playing flute is like this, so I can feasibly do it, even if I do it at a bit of a lower angle without hurting myself, but the amount of lung work that goes into playing flute is a lot. And that's the problem, that's the part that I've been having issues with, because my lung capacity since surgery hasn't been as good, because they manipulated so much from my chest, and muscles had to take time to, just stuff like that. It makes sense why I can't play as well as I used to be able to. I'm gonna replace this bit of scar tape, actually, because it's falling off, so I might as well show you the scar. Also, Miles McKenna had his top surgery today, the day that I'm recording this, not the day that this is going up. So my 1 month post-op was his op. So, I don't know, I thought that was cool. But yeah, that's this incision. There still is some not swelling, but fluid buildup here. So it looks like I have a tiny boob if I turn to the side. But I don't, that's just fluid that will reabsorb over time. So yes, right now my chest does not look 100% flat, but that is because of the swelling here, and that will go down. That's not staying there. This incision looks actually incredible. I'm super impressed with the way that it's healing. I'll get a bit closer to the camera. See, that's a really small line. A month ago, that was a gaping hole into my chest. It is a bit more, less healed over here, but I think that is just because that's where my skin is probably moving, right? It does look like dirty and dry, and that's because it is. I do keep scar tape over it like all the time, so dead skin just kind of builds up and the skin is really dry and it doesn't get cleaned or anything. So that's that, but that's not going to hinder the healing or anything. So I'm just going to continue putting scar tape on that for quite some time and let it heal. Fun fact, this is like kind of related. So before top surgery, I had a freckle like above this nipple, and now I have a tiny freckle below this nipple. I don't know if you can see it, it's right there. And I love freckles. I don't know, I think I used to have that freckle like up here somewhere. So it like just is now under my nipple, and I love it because I love freckles, and like I have a freckle by my nipple. I don't know. I like freckles. Aside from the complication here, one of the things that's the most annoying right now is like the condition of my skin, because I can't properly like exfoliate and wash around here just quite yet, because of the complication. Because my scars should be, like my incision should be completely closed at this point. My skin is just not able to be fully exfoliated right now. So I do have a lot of irritation where the bandages have been like on and off and on and off. You can see I have stretch marks here, but I don't care about that. I have stretch marks on my thighs, and I had them on my chest before surgery, so I knew I'd have them after. I'm genuinely not worried about stretch marks, and if anyone is, then good thing it's not their body, it's my body, and I don't care. I have a little bit of chest acne, which I've had since I started testosterone. And again, I can't really moisturize or anything. I wouldn't moisturize my acne, but put light creams on it. Another thing that I've noticed is that this nipple is really dry. This nipple is a whole nother situation. It's not even a nipple right now, so just, but because this is like baby skin, it's very like, you know, soft and still building itself. And since it has been so cold where I am recently, there's a cold front just passed through, and we're getting another one. Like, I don't have school tomorrow because it's snowing. So I've actually been putting like a tiny bit of Vaseline along here. Not Vaseline, but white petroleum. This was in the post-op care package that we bought when I went in for surgery. It had, I think, extra aspirin, extra scar tape, extra nipple dressings, just extra stuff that you might need after surgery. So we did get that. I put a bit too much on, but I've just been kind of like Q-tipping some Vaseline over my nipple. And I don't feel it, but it's not going to hurt my nipple, and it can definitely help with the dryness. Going back to school has been pretty difficult. I did mention that I'm going to do a video on going back to school after surgery. But again, I do want to wait until I'm healed so I know like the full spectrum of what I've experienced. Oh, I almost forgot to update you on the drain holes. So I think most of you know by this point that my drain hole on this side was a bit larger and more irritated looking, and for a little bit my mom was worried that it was infected, but we figured out it was not infected, it was fine, but we put antibiotic cream on it for a couple days, bandaged it up, and it's almost entirely closed now. There's a tiny bit of scabbing there still, but it is like a closed hole, it's not open anymore, which is great. And then this side was the one that did behave itself better. You saw it earlier, but oh, there's some Vaseline. You saw it earlier, but it's completely closed. Like, there's barely even a scar there. It's a tiny bit sore if you like touch it or press it, but just don't do that and I'm fine. So my drain holes are both completely closed up at this point. I'm not getting any more drainage out of them, so that means any fluid that is left in my chest will either come out through like a hole, which is not going to happen, or my surgeon might aspirate me, which is something that she's done to other patients. I hope she doesn't do that, but it's a possibility. Other than that, any remaining fluid will just be reabsorbed into my tissue over time. I actually go back to my surgeons tomorrow to talk about this nip. I just really want it to heal up so I can do a video on it and move on. I've actually applied for a job this summer at a kids' summer camp that I used to go to as a kid. My main worry with top surgery right now is that I won't be healed by then. And I know that seems ridiculous because that's still like 5 months away, but you know, if I go there and this nipple looks like it does now, I'll have a problem. But I'm sure I'll be fine. I'm healing at like a steady rate right now, so let's just hope it continues going that way. Another thing that some people worry about is dog ears, which is when your flesh kind of like bulges over the scar. I'm not experiencing that at the moment. You can probably tell from this side. This side's still taped up, so you can't see it all that well. But it's not happening on either side for me, which is pretty cool. I do still have some fat in like my armpit areas. And if I do get a revision, then that's probably what I would consider. But at this point, I'm still so like soon after surgery that it could still just be fluid buildup, and that could definitely still go down. So I'm not seriously considering that at the moment. But yeah, this is my chest 1 month post knives. I think that's it. If I forgot to cover anything, or if you have any questions, feel free to ask. Again, I hope your nipples are healthier than mine are, and I will talk to you later, maybe.